Dr. Jefferson has extensive experience in public sector management and policy, as well as strategic and board development, and has served on national and regional boards and committees. Ladies and gentlemen, let's welcome Dr. Delroy Jefferson, or Dr. Jeff, as he's known by many.
Thank you. Good evening. Well, I must confess, and I'm going to be apologizing to the team. I was supposed to have checked out the clicker to ensure that I know how to use it before coming up, but you'll work with me. Now, protocol having been established, I'm deeply honored to welcome you to one of the most highly anticipated healthcare conferences in the region. Welcome. But before I proceed, I just want to pause for a minute and ask for your indulgence. I want for you to celebrate with me what's currently displayed on the screen. It says, Top 10 healthiest countries, and number 1 in healthcare is Cayman Islands. So give yourself a big clap. And then I want you to pause for a minute and enjoy the flow of the endorphins and enkephalins and all the sweetness that came with that feeling. Because really, that's the plan. We're not quite there yet. We're going to be celebrating at some future time. I apologize. Can you imagine the feeling of accomplishment and pride when, in the future, you feel that you live in the country with the best health care? Now, we have advanced significantly over the years, but we're not quite there yet. The last 14 years, the themes and discussions and themes have explored how not only has it been instrumental in shaping healthcare at the HSA, not only has it been influential in shaping what's going on at the doctor's hospital, but over the years, or Health City, but over the years we've seen a change. 14 years ago, where we were at, we're now, 14 years later, at a much better place. Not there yet, but we are in a very good position to getting there. While several examples can be featured, I want to direct your attention to the fact that recently, in just early this year, the Health Services Authority achieved the status of being accredited by the Joint Commission International. And a big round of applause for healthcare, for HSA. This world-class recognition is a badge of honor. It is a resounding testament of the exceptional standard of healthcare that we have here locally within the Cayman Islands. And so this appetite, this thrust for excellence in healthcare and the implementation of new models and policies, it could not have been achieved without various policy personnel, government ministers, healthcare providers, the various paraclinical personnel, and all the stakeholders, including all the persons who are gathered here. Had it not been for your input, we would not have seen the development in healthcare that we're now seeing. But you'll forgive me for a minute if I just pause and speak about where my navel string is cut. Well, my second navel string, and that's the HSA. There's been a number of developments within the Health Services Authority. We have expanded to 2 new locations, the Smith Road Medical Center, which most persons are now aware that, it's a beautiful facility. We've also expanded into the Baytown House, and over 10 new services have been added over the past 14 years. We've seen cardiology, we've expanded into sports medicine, exercise medicine, chiropractic, urgent care, geriatrics. A very good friend of mine was telling me just now how she's enjoying her geriatrician. And it's a good feeling to see that, we have persons who are benefiting from the changes that have taken place over the past few years. We've recently commissioned Alex's Place, and some of you might be aware that this is a youth-friendly center which now complements our accidents and emergency department, providing vital care and support for adolescents who have been experiencing some mental issues. There's also telehealth that we've expanded into the sister islands so that now Little Cayman and Cayman Brac can have access to specialists on the large islands. Little Cayman can now have access to the physicians in Cayman Brac or in Grand Cayman. In past conferences, the themes explored include patient-centered care, achieving quality outcomes, and embracing emerging trends. By the way, the top 10 healthiest countries in the world, and this is Bloomberg's 2019, I promise you that you see where it's the number 1, Spain, that's exactly where we're going to be. All right? Okay. This year's conference is curated by the organizing committee and features a diverse range of sessions. The ministers already alluded to some of the exciting sessions that we're going to be hearing as the week progresses. The theme, as you already know, centers around bridging the gap between patient and practitioners, a pathway to optimal health. And we know that one of the most important aspects of healthcare is not even so much the medication that I can provide or the other physicians, but it is an understanding of that vital important communication. Communication, empathy, trust are the heart of building strong and open patient-practitioner relationships. And so in closing, we hope that this conference strengthens the understanding of how to nurture the vital relationships between healthcare providers and patients. It is crucial to appreciate each other's role and responsibilities on the journey toward enhanced healthcare experience and improved health outcomes. I hope we also remember how far we've come. Over the years, we've come a good way, far. Our CEO, who over the past 14 years has chaired the healthcare conference and who has been here for several years, I'm not going to say how much, just in case I give her age, but over the years, quite a number of persons sitting here in this room recognize where we are now compared to where we've been and where we're coming from. And so together we can continue to make significant strides in the field of healthcare for the benefit of the community. We're moving in the right directions, Let's continue to progress. Let's continue to work collaboratively with empathy, and let us be dedicated to seeing ourselves on the magazine of Bloomberg, where we will be the #1 healthcare country within the world. Thank you very much.
Thank you very much, Dr. Jefferson, and thanks as well to the HS